What does it mean when a child refuses to engage in therapy? Sometimes, on rare occasions, we find a child or a young person doesn't want to attend the sessions, or when they do attend, they want to leave early. Why is this? In these cases, it might be that the child, 1, isn't ready for therapy yet. It might be too soon for them to feel ready for therapy. Maybe things feel a bit too raw, or maybe they're still in the middle of a difficult experience. Therapy can feel overwhelming if the child is still trying to get through challenges in their life. It opens them up to being vulnerable and expressing their thoughts and feelings, and this might just feel too much at that moment in time. Sometimes a child or young person will have a really successful first session, but something inside them realizes that these sessions are going to bring up difficult memories, feelings and emotions, and so they shut down and withdraw in order to keep themselves safe. It just isn't the right time. What can we do? In these situations, we give the child as much control over coming to the sessions as we can. It's important to let them know that they're not being forced to come here and that it is their choice. Our therapist will let the child know that they will be there for the session and will follow what feels right for the child. If they want to come for a while and leave, then they can. If they want to miss a session, then they can. If they turn up halfway through, we will be there waiting. In some cases, it is just as therapeutic to allow a child to choose not to come and have their voice heard as it is to attend. 2. They struggle to trust people. Another reason might be that a child or young person is struggling to trust people. When they've been through something complex, like repetitive loss or a breakdown in relationships, they can find it really hard to want to make meaningful connections with people. The therapeutic relationship means someone's there for them every session without judgment or expectation. And this can feel really good for lots of children, but it can feel a bit scary for some, especially when their experience is that positive relationships will come to an end or break down. For these young people, it can feel easier not to engage than it does to trust someone and be let down by them. So what can we do? In this case, the initial relationship building might need to be slightly different to help with this. Our therapist might not jump straight into therapy, but instead meet the child or young person in a more relaxed environment, like the classroom or home or a youth centre, to remove some of the perceived pressure. However, if a young person isn't ready, we will never force therapy. It's okay for them not to want to come until they feel ready. If their experience with us is a positive one, then we hope that means that they'll engage in therapy at some point in their future.